when they started getting these really wonky results, the problem that that ended up manifesting was they started obfuscating truth to people that they should have been truthful with. So it's very possible if they'd gone a different route, even though they ran into those challenges of having these discrepancies.
I don't know if this was, I don't remember if it would have been up your alley there at the FDA, but are you familiar with Elizabeth Holmes?
Yes, very, very familiar
Okay.
with that. I had actually, yeah, my wife was just reminding me of this because I had been talking with them. I hadn't gotten into. I forget if I had done an initial interview with them. I think I'd actually spoken with them and done an initial interview with these people before this all went truly sideways. Because it was a group at the time when I was looking at this before all this came out, it had looked like they just needed good regulatory help and not that there was like malfeasance. It was just it appeared from the outside that they were able to do what they were claiming scientifically, but they lacked, adequate guidance, let's say, and assistance with somebody who was savvy about the regulatory landscape. But it turns out, as far as I can tell, from what's come out in the intervening years, it looks like there's nothing I could have done to really help these people because there were some real fundamental underlying issues about the truthfulness of the information that was being presented.
Yeah, I
So
read Tyler Schultz has. I mean, it came up as one of my free reads, and I was like, "Oh, conspiracy! This will be perfect for the season." So, it was a really short read, but it's this guy who is a part of the project, and he started like seeing red flags fairly early or earlier than a lot of other people, and um, it's
and
kind of
you have to
his.
be You have to be
But
careful about it though too, because like on the flip side, I believe that what they were trying to achieve is possible. And the problem is what we're finding out with a lot of lab developed tests, and FDA is now trying to push Congress to make some changes to how lab developed tests and these sorts of diagnostics that Theranos was working on, how they end up getting reviewed and approved or put on the market, that there would be sort of a fundamental shifting in how that whole landscape is managed. That may very well have been one of the things that was messing Theranos up, was that they were trying to use some of these tests, and these tests are not interchangeable. Some of them perform better than others, and when they started getting these really wonky results, the problem that ended up manifesting was they started obfuscating truth to people that they should have been truthful with. So it's very possible if they'd gone a different route, even though they ran into those challenges of having these discrepancies, if they'd actually pushed into that, it's possible they would have made their way through it. And I think somebody could end up doing effectively what Theranos was trying to do. The problem is, instead of actually trying to pursue truth and trying to get to the bottom of what was causing the discrepancies, they decided to like paper over it. And then, the whole thing went sideways. And that gets into something else, I think, that's similar to what we've talked about, in terms of just how you want to operate in the world. If you are pursuing truth, then you can build something meaningful. Whereas if you start lying even to yourself, I mean, you very quickly bring just all kinds of calamities down upon yourself and the people around you.
yeah, reading that book, it was interesting because there are a number of different ways that you can lie or obfuscate. truth. So, some of them, I took a statistics class, terrible at it, but I
Lying with
did.
statistics.
Oh, I appreciated all the various ways that you could just manipulate things. It's like, well, I can just change the test and it'll give me, a different outcome. And it's kind of cool what you can do, but it also gave me a lot less faith in a lot of these statistics and tests and things. So with Theranos, they've got, I forget exactly how it worked, but he talked about how, let's say you need 95% in order to move forward. It's like, well, they might have been at like 60%, but they were, if they increased a little bit, well, they were 95% better than what they were before, or something like that. I forget exactly what they did, but they would change the numbers. So you have people who are purposefully changing numbers, but then you also have, like, he talked about the just how gregarious Elizabeth Holmes was, how just outgoing, and like how confident she was. And like he'd look around and be like, well, everybody else like believes it, and they must just see things that I don't. How easy it is to put your head down. And it's not really a conspiracy when you've got people who really believe this stuff to a certain extent. A conspiracy, the way that we call things conspiracy, but you've got a lot of people going along with things that are really shady, and they just don't see it.
So I wanna bring up an image that I love. It's this
Yeah.
interesting image, and we can drop it. We can drop it into something later. Data, information, knowledge,
Yeah.
insight, conspiracy theory. And and again, my view is when you connect those dots in that sort of final sort of picture where it's a flying unicorn. Okay, it's a
Hmm.
pink flying unicorn. It's conspiracy theory. And you sit here and you go, well, it's only a conspiracy theory if your intuition is wrong. If
Hmm.
putting all these dots together into that shape ends up being false, then sure, it's conspiracy. But sometimes your intuition is leading you in correct directions about how some of these various bits and pieces are connected. The thing we need to be careful about is what conclusions we draw from that. And that's what I'd say about FDA, in general, and our government agencies, and the way that we navigate, health information, and medical products and other products coming onto the market. And even in situations like Theranos, where they were, um, they were taking actions that were not in the best interests of their customers, of patients, of the rest of us, and even of future people who might solve the problem that they said they wanted to solve. So they've actually made it harder because of what they did for anyone else to come along and try to solve that same problem, because you now get painted with the same brush that Theranos got painted with, as okay, well, that's a really nice story, but the last time anybody did this, it was a bunch of lies. um, and it's just a shame.